Good afternoon to all the respiratory therapy faculty currently watching. My name is Tennessee Soko, and this is my interview for the CCBC Essex Respiratory Therapy Program. So now let's get into what the role of a respiratory therapist entails. After completing Respiratory 101 last semester, I've developed a strong understanding of what the role of a respiratory therapist truly entails. Respiratory therapy is a dynamic and critical part of healthcare. A respiratory therapist, although contrary to popular belief, does not only give breathing treatments. They also assess, treat, and care for patients with both acute and chronic cardiopulmonary conditions. This includes managing everything from asthma, COPD, trauma, sleep apnea, and respiratory distress in both emergency and long-term care settings. Respiratory therapists perform vital diagnostic procedures like pulmonary function testing, arterial blood gas analysis, and sleep studies. They manage life-saving equipment such as mechanical ventilators, BiPAP machines, CPAP machines, and a variety of different oxygen delivery systems. In critical care, a respiratory therapist is very hands-on with ventilator management, airway clearance, and assisting with intubations. Also responding to cold blue resuscitations. Anything that involves helping someone breathe or restoring somebody's ability to breathe, you can bet a respiratory therapist will be a part of it. So beyond the technical side, a respiratory therapist is also an educator and an advocate. They explain treatment plans to both the patients and the families, teach the proper use of inhalers or other devices, and offer support to patients and families during some of their most valuable moments. Now let's get into what makes me a viable candidate for this program. So I come from a family of both teachers and healthcare workers, primarily on the nursing and nursing assistant side. So I was raised in an environment that values caring for others. In high school, I developed a strong love for the sciences. And in 2021, I discovered the field of respiratory therapy. And I've decided to pursue healthcare ever since, and I've been committed to that goal of becoming an RRT since 2021. So while balancing work and school, I've completed my prereqs and gained important skills like leadership, customer service, adaptability, and interpersonal communication. I believe that these will help me thrive both in the classroom and the clinical setting. One of my biggest strengths is adaptability. Now, I've faced unexpected life challenges and demanding coursework. But instead of giving up, instead of throwing the towel, I simply pivot, adjust, and push forward. Never giving up. I've learned how to manage stress, mitigate stress, and prioritize responsibilities, study effectively, all while staying committed to my goals. I also see myself as a lifelong learner. I plan to continue my education through advanced certifications like the ACCS and the SDS, and eventually earn my bachelor's and master's degree in order to one day help use my experience to teach the next generation of respiratory therapists. Due to the fact that I've largely seen a shortage of respiratory therapists all over the country. Handling the disagreement with a student in clinicals. So I grew up with 4 siblings, so disagreements is something that I've had to navigate from a young age. I'm not naturally confrontational. In fact, I often found myself acting as, I guess you can call it like a mediator, using active listening and patience to understand everybody's point of view. So if a disagreement were to happen in the clinical setting, I'd take that same approach. I'd stay calm, listen carefully, and try to understand where the other student is coming from and their perspective, like putting myself into their shoes, basically. Then I'd also look for common ground so we can move forward without disrupting patient care or the learning environment. Now, if we couldn't resolve this problem on our own, I would not hesitate to bring it up to a clinical instructor, not to escalate the issue, but to protect the professionalism and safety of our team and patients. In closing, I'd like to thank you all for taking the time to consider my application. It would be such an honor to be accepted into this program. I've been working towards this goal since 2021. I'm truly excited. I'm truly eager to learn. I'm ready to give the program my full effort and become a compassionate, capable respiratory therapist who makes a difference. Thank you so much. Have a great day. Once again, my name is Tennessee Soko.